Hi, I'm Brian Deluski, founder of the HomeAides. The HomeAides is a non-medical homemaker companion agency providing caregiver services throughout Connecticut and Massachusetts. The HomeAides provides both live-in and live-out hourly services. The HomeAides was founded and operates on three primary values. One is a belief that our clients deserve the very best caregiver services. Two is a commitment to client satisfaction through quality service plan management. Three is a commitment to transparent pricing with the best price guarantee.
The HomeAides has partnered with over 250 community facilities throughout the states of Connecticut and Massachusetts, and this number continues to grow almost on a daily basis. The HomeAides works closely with social workers, case managers, and discharge planners of the rehabilitation centers and hospital networks throughout both states to ensure a smooth and safe discharge process so that caregivers of the HomeAides can then continue to care for their discharged patients. The HomeAides works with assisted living and independent living communities, providing companion care and homemaking care services, and for the most delicate residents in need in the memory care communities, the HomeAides is happy to provide eyes-on care. Our goal is to provide quality caregiver services with transparent pricing to give families a greater peace of mind at the best price guarantee. We aim to make the referral process as simple as it can be. We have the options, of course, of calling, emailing, texting, and we also have a referral partner portal on our website where you can easily submit information to us. A home care coordinator will then immediately follow up to talk about the needs and how we can provide services.
All of us have all been in the situation of suddenly needing care for mom, dad, grandma, who are having some level of difficulties. And during this emotional time, we really need someone who's understanding, compassionate, and able to talk and walk us through the caregiving process. When we speak with the family, we share our transparent pricing and our best price guarantee and caregiver match process. Each individual's needs and wishes and health concerns are considered when pairing a caregiver. And based on the information you share with us, we assist by offering a service plan, whether hourly or live-in, and a schedule and then review of our fees for the various services. This information also goes into creating the detailed service plan for care. We then establish a caregiver schedule, which we share with our scheduling team to coordinate the start of services, and we stay in touch throughout the whole process. Once care has started, you'll be receiving ongoing support from our service plan managers who oversee our caregivers.
With the caregiver matching process, what we do is when our home care coordinators receive the information from the client's responsible party or the client themselves, we try to get as much of the information based on their unique needs, such as personality, what their needs are, and then match it specifically to our caregivers in our database. We want to be able to match the strength and the experience based on the client's unique service plan. The service plan management team here at the HomeAides, they're responsible for going out every 7 to 10 days and actually making in-home visits. They are an additional support not only to the client and the family, but to our caregiver that is in the house. This is going to help with review of the service plan, seeing if there's any changes in ongoing education, as well as constant communication with the family and the responsible parties. The service plan manager will go over the service plan, the needs of the client, and see if there's any ongoing education that the client and or the caregiver or responsible party may need at that time. The service plan manager will stay in constant contact with the families or the responsible party as well as the caregiver, not only at their time of visits, but any time in between. So if they need to do any updating on scheduling, if the responsible party has any concerns or questions, they will have each of their service plan manager's phone number at hand. The service plan managers are available during the day at the needs of the client's family, and or the caregiver. They can text or call, and the service plan manager will reach out, connect with them, and address any of needs or concerns that they may have at that time. The service plan binder is a tool that is used for the caregiver as well as the client's service plan. It has the unique needs of each client and the key points of that case, as well as all of our policies and procedures for the caregiver as a reminder. It holds their timesheet, and it also has the daily documentation that's important not only for the service plan manager, but for the client's family and the responsible parties to check in. Another way to communicate and another added resource. So our caregiver transportation will actually bring our caregivers to and from each case. We will pick the caregiver up if they do not have a vehicle or they don't have a license or if they don't drive. We will bring them back and forth to the case, to and from at the start of case 7 days a week. What the transportation adds is that it helps eliminate call-outs, the possibility of lates, or weather issues that are related to caregivers trying to get to cases. We provide transport in rain, shine, or snow.
The HomeAides is committed to working with our community partners and providing caregiver services to allow for safe discharges for clients and families in need.